trying to adapt our services. And I first also want to just share with you, just in case anybody had any questions regarding unemployment insurance and the PUA, the Pandemic Unemployment Assistance, how we have been supporting the community is our local New York State Department of Labor staff, who we are co-located together for the Ulster County Career Center. So they have been assigned, because of the massive amount of individuals on unemployment, they have been assigned by the Albany office to do unemployment insurance. So they're not doing their usual reemployment work in concert with us to get people employed. They're working on unemployment insurance right now. So right now we're missing half our usual full team here in our center. So how we've been supporting them is that we've been taking any calls that if anybody has any unemployment insurance issues, that, if people are calling and they're saying they're not getting through, you could actually let them know to call our office, and then we will get that individual connected to a New York State DOL staff member. So I did want to put that out there. If anybody still knows any other clients or individuals who are still struggling with applying for unemployment, please send them to our office so that we can then connect them to one of the New York State Department of Labor staff who are currently working remotely. So because they've been working remotely, we've had to adapt our services here as well, and to follow safety protocols and to be able to still provide services to the community. We had to come up with different ways of approaching services. So we have reopened our office, and during phase 3 reopening, and we have started doing services by appointment. So we do have all plexiglass up in our training room. We adapted as an interviewing room. So we have 4 interviewing stations where we do meet with individuals to be able to do paperwork if they cannot be provided with services over the phone. And so, my staff, we're wearing gloves, we're wearing masks to make sure everybody is, following protocol to be as safe as possible. We are taking temperatures if anybody's coming in. We do have tape on the floor as well to maintain 6 feet. And so what I'm going to go with you through, talking with you all today is just everything that we're doing to just be able to provide services. So all my staff, we all do have laptops. So half staff are able to work remotely. And at first we were at, 50%. And so most staff were working remotely, providing services to current customers. Anybody new coming in, we are still able, if they have a computer, to do Zoom or Skype sessions, or we can meet with them individually in our training room that we've adapted to the interviewing room. We try to do as much information over the phone first prior to meeting with the individual, so that way it lessens the time of in-person interaction. We do have some resources on our website. New York State DOL has interviewing streaming, where it's a virtual interviewing application. So we have been giving out that information as well, but we're also able to interact with customers through Zoom and processing that individually. We have put some workshops on our website as well, virtually. We've had to do that for our summer youth employment program that I'll talk about in a little bit, for the youth to have their orientation. So we've adapted with doing webinars. We have really been utilizing Zoom. I know Anthony Vignon is on here. We had to do our workforce development board meetings through Zoom as well. So we've really been trying to transition any group workshops that we've had to do in the past to put them on Zoom and working to get those on our website. And we also been able to, what I'm going to share with you, some training opportunities virtual that we've been able to put people in that we're going to be actually starting next week, and another program that we have that's going to be till the end of the year, a virtual training program. One other resource I want to share that we provide a service is our disability resources services, Ticket to Work program. Troy Snyder, he's wonderful. He's our disability resource coordinator. He has adapted during this COVID-19 pandemic very well with his customers. We put together a webinar that's available on our website where he talks about the Ticket to Work program that supports individuals transitioning from SSI and SSD to work and gain independence. So individuals are interested in learning more about that program. They can watch the webinar first. That way, because that workshop we used to have in person. So now they can just go to our website, watch it first, and then email him, and then he can have a Zoom session or in-person session to further get them set up and further support them. So if you have any clients or customers that would be interested, you know, in getting more information about that service, please contact Troy, or you can call our main number here as well, the 3170. So one of our virtual job readiness programs that we are actually starting on Monday, we made a partnership. It's actually the mother agency is Albany Ken Code, and recently they have launched. We're the first cohort that they have launched, and they chose Kingston as that cohort to bring the coding resources down here to our area. So they launched the Kingston Ken Code. It's a partnership that they've made with our county to provide virtual programming, coding. They also are partnering with Ulster Community College as well, SUNY Ulster. In the fall, they're going to be doing a web development course. And I had asked them, you know, is there anything that we can do during this time of COVID-19 to offer something to the community? So they had an in-person digital literacy course that they were doing previously, and they wanted to try doing a virtual digital literacy course to see if to respond to the need of now that everything is, you know, Zoom and everything's going electronically, that we can be able to get people these skills that are so needed right now. So Albany and our area are the only ones that have launched this program to be providing virtual digital literacy classes to the community. So this course is a 10-week course. It's launching on Monday. We have a couple individuals registered. They're really excited to be able to gain these skills. And, you know, they're going to be able to, you know, not only learn how to use a computer, learn the functionings of it, but they're going to have a one-to-one counselor to be able to then do some, you know, resume building, career readiness, and also at the end of the course, there's an introductory to some coding, so that if they do really well in the course and they're interested in that coding, web development, that they can then go further on into the SUNY Ulster program. So it's a nice little segue to see that if this is something that sparks their interest, that they can move on into the full coding course that's going to be held at SUNY Ulster. So that's just one of the ways that we're identifying what is the need right now, what skills, what are people going to need in order to re-enter into the workforce. And another job readiness tool that we've been able to partner with is Coursera. Now, Coursera, this is, I definitely want to share this all with you because this is an ongoing partnership that we have to the end of the year. So Coursera is an online education learning program, and they have developed this Coursera for Workforce Recovery, this partnership with local governments to provide free access to all the community, especially those on unemployment. So we have engaged in this partnership with Coursera. We have been able to outreach to 10,000 individuals on unemployment through our one-stop operating system to inform individuals who are on unemployment currently right now about this opportunity. And so there are, they can get a Google IT certificate. There's, 3,000 plus courses on here to be able to upskill and reskill and re-enter the workforce. And so anyone they have until September 30th to enroll, and then up until December 31st to complete the course. So this is absolutely free. And in order for them to be in this program, they do have to email us. So you can make an account on Coursera, but they have to go through us because it's not free unless they go through us. And so I do want to just pop out of this and I'm going to show you what that platform looks like. I just want to show you the opportunity that it provides. So I'm going to just reshare 1 second. So this is what it would look like if someone signed up for our Coursera account. So there's a lot of different categories. One of our most popular courses are Excel, as well as they have the COVID. They do have the contact tracing certificate as well. So there's a lot of different courses and a lot of different certificates that people can get. And we have the ability to track what courses that people are taking to see what the interest is. And the person who helped design what courses that were in this Coursera for workforce recovery, she actually has that experience in workforce development. So she was able to curate courses that would be in demand skills at this time. So these are all like the courses these are curated courses that she put together, but there's more courses that they can take. So that's all, if they want to explore, they have the opportunity to do so. And then what I want to show you just on my end of, what I want to show you on my end, what it looks like of me tracking. So as you can see, I've been able to send out 10,245 invites to individuals, and we have 418 learners that joined and 223 that are actively taking courses. So we have partnered with the Ulster County Library Association, the 21 libraries in Ulster County, to help us promote this so that we can reach as many people as possible. So they're actively working with us to promote this opportunity to individuals in the community. So it's not just for unemployed, it's for anyone that needs to, up their skills and get a better job. So, please share this information with everyone in the community because this opportunity is free. And I have the ability to sign up 10,000 individuals. So I'm just going to go back to my PowerPoint. And yes, and so as I said, these skills are, the type of courses are endless of what they can get in, and it's at your own pace. So the virtual digital literacy program, that is by an instructor, but this one is at your own pace. So as I said, we do have this till the end of the year. So if anybody is interested, please let us know. All we have to do is, and all we need is a name and an email to sign them up. And it's a wonderful resource. And now what I want to talk about next, this is the main service that we've been working on, is our summer youth employment program. And we were really worried this summer due to COVID-19 if we were going to actually be able to launch this program, because it's so important. But we were worried about how are we going to keep the youth safe at work sites? How are we, would OTDA let us have youth at work sites? So we were planning, and we got the final okay about how we could really roll out this program. So we have it prepared. We're going to be rolling it out on Monday. We have youth assigned to over 40 work sites. Everyone has been trained. The youth have had virtual orientation, understanding that they do need to wear their PPE, their masks, and maintain 6 feet distance. The work sites supervisors, they have been educated as well, with virtual orientation about, their safety protocols that need to be maintained. We've been able to, and even there was a struggle with us initially of getting the youth. How are we going to safely get applications for youth? So we were creative to do drive-by applications. So we had the parents make appointments with us, and they were able to get us the applications by stopping by the office, and we carefully, had gloves and masks on and made sure we made the copies of, all the documents that we needed to. So we're about placing over 120 youth in the Summer Youth Employment Program. We're really excited to be able to give youth this opportunity to be able to, make a wage during this, tough time that they may so need it. And we are doing a little bit of incentives with them as well. So a little monetary incentives with the youth as well. And then we're going to have a cohort of youth working also again with Albany Can Code for a web development coding program. So that's also. So our program this year is going to be 4 weeks, due to the late start that we've had to launch this. So that coding web development summer program that's coinciding with it, that's also going to be 4 weeks as well. So we really try to be as adaptive and, as creative as possible with making sure that, the youth in each work site are, we have a lot of outdoor opportunities. We have a lot of opportunities where youth are doing some creative projects with some of the nonprofits that we place with them, and a lot of the, pantries and supportive services that the youth are working with. Everybody has been really creative with creating job opportunities for the youth. I know we've just partnered also with Ellenville School District to be able to provide some youth there. And those youth are also going to be provided with job readiness skills in concert with their site. So we've been really creative with and dynamic with how we're placing each youth. And, we're really confident that that we're going to be able to pull off, a great program this year. And so we're continuing on to, we're waiting on more funding for training. So that's something that we've been waiting on, but, that's what we're preparing for the fall. It's just, training opportunities and just preparing for, especially, after the 31st, when the pandemic unemployment assistance stops, we're preparing for that wave of what training opportunities. We just worked with the Department of, the Office of Economic Development. We sent all the businesses workforce needs assessment. We designed that with them to see what are your businesses looking for? What skills do we have to train individuals in to help them get back to work? So we're waiting for the results for that. And when we get those results, then we'll be able to work, with our training providers to then inform them of this is what the businesses need. These are the skills that they need for their workers to have, so that we can make sure that we're putting people in those trainings and helping them get back to work. Does anybody have any questions?
So as I shared earlier, if you have questions right now, put them in the chat box. We do have one already, Thomasine. This is from Willie Yee. When does the Coursera start? Is that ongoing, or is there a date?
It started, yes, it's ongoing. So I have the contract now. So you can just send, individuals to us. They can email us. We just need a name and an email, and then we can get them signed in. And you just, we let the person know that, when we put their information in, when we send them the email invite, they automatically get, an email with all the information. And then we let them know that they need to make sure that they're enrolled in any courses by September 30th. So even if they don't want to, finish it right away, just enroll in as many courses as possible, because you have to enroll by September 30th, but then you have December 31st to complete it.
That's good information. Another question I have from Chris O'Neill is, are you accepting new applications for summer youth employment this year?
We just finished, but give me a call after to see what I can do. Because we are starting the program on Monday, but just give me a call and I can see what I can do. If you have
Okay.
some.
And then what is the email address to refer people to?
OET@CO. Oh, sorry. I should have, that's in the email, sorry. OET at co.ulster.ny.us. Sorry, that was my last slide.
Okay, so it's OEP at
Oh, OET
CO.
as in training. OET.
OET. Okay, so I'm going to put that in the chat box. OET. So there it is. You correct it if it's wrong, but here it comes.
You got it.
Any other questions?
Yes, I can definitely send the email out to everybody as well.
That's great. Other questions? I think it's amazing how quickly you have really, addressed unemployment needs and put everything online for people to be able to, up their skill set and connect with you, which, we know is so important at this time.
Thank you.
So I can't thank you enough for sharing your presentation. I know that for a lot of our agencies and organizations, we encounter folks that could use your services, and we can refer you to you.
Yes, thank you.
We do have another question. Can people view the courses before enrolling?
Yes, they can definitely browse. It's just like any other online program. They can just browse the courses through. So you can join the Coursera. So when we send the invite, they can just join it first. Just make an email. Just make it a Coursera account, and then they have time to then enroll in a course. So they can browse through and see what they would like to do. But we had some great success so far, and we were shocked to see the amount in just one weekend. We did it on a Friday, and then on a Monday we had already 150 enrolled in just even that short time. So now we're up to 400 that joined the program, and then we send them emails, reminder emails that hey, we've seen that you haven't enrolled yet in any courses. So we do all that back end work.
And we have another question. Is there any opportunity for devices for people who don't have any? I'm assuming they mean, computer equipment or tablets. Can people still come into your office?
So we are working on having 4 computers available. So the issue that we had is Department of Labor, those are their computers. So, but our computers are in our computer classroom. So what I'm doing right now with our information services team, that we're taking 4 of our county-owned computers and putting them out in our resource room so that people can have access. And then we'll have it, time limited, 45 minutes to an hour. So people will have access. Also, I have to get the word from all the libraries, but I know that Kingston Library, they're working on having, I know just Wi-Fi available. So if internet is an issue, but maybe somebody can, has a phone or, they have a tablet, they can go get Wi-Fi in the parking lot of Kingston Library. And there is a Coursera app, so people can do this from their phone. So that's something else that, I will remind people who's ever enrolling, that they can download the app and they can take the courses right from their cell phone.
Wow, that's great. Do we have any other questions for Thomasine? So we have a question from Christine about getting copies of your presentation. I should be telling you all, and I am telling you all, that we are recording this meeting, so it will be available on our Healthy Ulster County .org website, which we'll share at the end of our meeting, and you should be able to get a copy of the presentation. Yes.
Oh, I also wanted to share that and New York Association for Employment and Training, Ulster County, because of our partnership with Albany Ken Code, Kingston Ken Code, and Coursera, we were featured in this week's Workforce Buzz. So, which is huge because, you know, it's one out of all the counties. So so it was a nice thing that they decided to feature the work that we're doing.
That's wonderful. Congratulations.
Thank you.
Well, thank you very much, Thomasine. We so appreciate you being able to share your very valuable program with us, you know, and for everything that you do, especially during this time where it's so relevant. We're going to go right into talking about the update on our Ulster County Inventory for Health Assessment. This is an important tool that the Department of Health has been working on and maintaining for the last few years. It is a tool which identifies which agencies and organizations and schools are working on the Robert Wood Johnson What Works for Health policies and programs. These strategies are a menu of tools and policies and programs that can be used locally here in Ulster County to improve health outcomes, and they ultimately do have an impact on our county health ranking. This inventory for health that we put together actually helps to identify all the strengths that we have and gaps in how we as a county are addressing community health through all of our agencies, organizations, school systems. So it's a really important tool. It's kind of a little picture in time each year of what everybody's working on. So we're working to update it. So in updating the inventory for health this year, we have a new assessment tool. It's been designed to align directly with the language and the descriptions that are in the Robert Wood Johnson Foundation's What Works for Health policies and programs. So community agencies, organizations, and schools, you're all asked to self-identify which health factors are relevant to the policies and programs you're working on. It used to be that we sent out a survey and we kind of asked you what you're working on, and then we sort of have to interpret it and decide which Robert Wood Johnson policy or practice you were actually aligned with. But we've got the language in there so you can actually self-select it to the best of your ability. So then you're asked to review the section in the inventory assessment for each of these relevant health factors which are identified, and you determine which policies and programs in particular aligns with what you're doing. So you're then asked to list the program. So how is this happening? So a lot of you that are regular members of the Healthy Ulster Council already received this a month or two ago. You got part one and a request to sort of self-select a topic area. And then we send you another section and we actually enter it in this. So let me show you how that works. Here are the 12 sections, and you'll get an email that'll actually ask you to choose one of these 12 sections for all of the things that you're working on in your everyday work. So whether you're working on alcohol and drug use, or your programs address diet and exercise, sexual activity, access to care, quality of care, social and economic factors, education, employment, family and social support, income, air and water quality, or housing and transit. These are all of the health factors that Robert Wood Johnson Foundation actually looks at to determine how healthy our county is, what's going on, how many programs do we have, how is it working, what are we doing to address some of the issues that we have. So we will be sending you, if you haven't received it already, a questionnaire to choose one of these 12 topics, one of these 12 health factors, and select it. So this is the assessment tool. It's going to come in your email. It will have two parts. In part one, you select one of those 12 health factors. When you do that, you send it back to us. In part two, we see which sections you chose, and we forward you those sections, and you basically skim the titles in the sections that align with your program. Then once you decide this one looks like mine, you read the description. You don't have to read the whole document, just the ones that match titles that look like it might be like your program. And then you select that policy or program, and on the line you provide the name. So this sounds pretty kind of out there, so I'm going to show you how it works. This is exactly what is sent to you. You basically in part one get this list. You say, wow, I do nutrition. I do nutrition education, so I'm going to pick B, diet and exercise. I check it off and I send it back. That's it. That's part one. Part two, I didn't actually choose nutrition and exercise because we had Thomasine here today. Talking to us about employment. I actually picked income and employment. So this was section H, and we're looking here at some of these health factors that relate to employment. I basically skim the titles. I'm going to look at job sharing programs, on-site childcare, paid family leave, GED certificates. If I do any of these things, I place a check mark after I've read it and say, that's it, that's what I do. And then I put what my program name is. So for what Thomasine was just describing, it might be youth employment or it might be the Coursera. She might put that as her program name. And that's it. You save it and send it back. So it's a really easy assessment, but it's really important to us. And it's going to be important to us as a county to fill out. This is a single page of what the inventory for health looks like. And you can see, again, I picked, because we did have a presentation today on employment, I chose that section. And where I see here GED certificate program, I'll list all the agencies and organizations that responded that say they do that. And when we're done with this inventory, updating it, we have a really good list of how we're addressing so many of the disparities of health that we have in our county. And as you can see by the Robert Wood Johnson factors, it's everything from housing to education to diet and exercise to access to care. There's so many components to health. And when we have a good picture of this, it really helps us make decisions, and it will help you too, because it will be available to you at the Healthy Ulster County website. So you will be able to use it as a tool as well in deciding what programs it seems like, hey, there's an opening there, there's a niche, and I want to try to address that. So this is a really good tool for everyone. So as you get this in your email, I want you to you'll know it's coming. For those of you who received it already, we're probably going to resend it, and you get a chance to take a look at that. So I want to know, does anyone have any questions about this? You just stop sharing here, bring up the chat box so I can see. If you have questions, throw it in the chat box. And if not, we're going to move on into the next part of our program. But I just wanted to be sure before I move on that everybody understands what will be coming to you. We've already mailed it to our conservation advisory councils, to the schools, and again, to Healthy Ulster Council members that attended meetings last year. We would like to include everyone who attended meetings this year as well. So we'll be sending it to all of you. And then, we have all different groups that we'll be sharing this with, but we're just getting started. And as we start to head through different mailing lists, we'll start filling this out for the year. So again, any questions about the Ulster County Inventory for Health? Okay, I'm going to go back and share my PowerPoint again, just so that you have an idea of where we're going next. So this brings us into this part of our program. I think we're all looking forward to. We'll be having a facilitated discussion on outreach and recruitment during the pandemic. So the way that we're going to do this, because we do have 28 people in our meeting today, is we're going to basically put you into breakout rooms. So there'll be about 5 people in your breakout room. You'll have 15 minutes to discuss the topic. So the first thing you're going to do when you get there is choose a reporter. That's the first thing you want to do, because when we come back as a full group, your reporter will share what happened in your breakout room. And then you're going to, as a group, list your top 3 concerns about recruitment and outreach. Everybody, has been experiencing something different during COVID-19 in trying to implement their programs. And we know just from the work that we do that it was not too hard to transition our programming online, but a little harder to get people to the program. So if you have concerns about recruiting people to your program or getting your educational message out, this is a place for you to have a conversation about it and come up with as a group your top 3 concerns. Then you will also list 3 top ways that you all are solving these problems and working to recruit new clients or conduct outreach when we're dealing with online programming and social distancing. And, if we have anything indoors, we're wearing masks. Or outdoors even. So it is a different environment to be implementing all the many wonderful programs that we do, but it would be great to share a little bit, I think, and problem solve a little bit on how we're doing it. So I am going to stop sharing this. What we'll do is we'll also put these questions in the chat so you can refer to it. But you should remember that you're looking for 3 concerns about recruitment and outreach and 3 ways you're solving it. You're actually working to recruit new clients or conduct outreach. That's what you're going to come out with, and a reporter. You'll have 15 minutes, and it should just throw you back out into the main meeting. So I'm going to stop sharing this, and it'll take me a second to set up your groups. Does anybody have any questions about that? Put this back up. Here we go. So you're back. We're going to put the questions back up for a second. So remember, you were going to be choosing your top 3 concerns about recruitment and outreach and 3 ways you're working to recruit new clients or conduct outreach. So like if you are a reporter for your group, you have a way to raise your hand, but I think, why don't you just come forward? You can unmute yourself and share what your groups have. We have 6 groups, I believe. So Katrina.
Hey, yeah, sure, I'll go first. So in terms of the concerns, we talked about a bunch. I'm going to kind of narrow it down. So sort of in general, we talked about difficulties in sort of connecting and engaging with folks on a virtual platform. Also, that people don't always have the equipment or the technology that they need. And in our group with Kristen from ShopRite, who also talked about, the fact that their customers, it's like foot traffic. So engaging people virtually is like a bigger shift for some programs, more so than others. And then we also had Michelle at Head Start talk about, the safety concerns of parents, in a preschool setting, and how to kind of outreach and engage when there's so much left unknown about the future, and we don't really know if it's going to be safe to come back to certain services.
Okay. And did your group also discuss ways that you're working towards solving some of these issues?
Oh, yeah. So we talked about the different, virtual options and the ways that people have been creative. Lots of talk about social media being used to kind of outreach and engage folks. Even things like mailings and yard signs were mentioned. And we also talked a little bit about incentives and giveaways in terms of engaging people. Are there things we can do to entice people to participate?
Mm-hmm. That's great. Anything else to share for your group?
I don't think so. I can't remember anything. Somebody could let me know if I forgot anything important.
Okay. So can we have another volunteer reporter?
I'll do it.
Okay.
Willie E. From breakout number 3, breakout room number 3. We had talked about, it's similar to what the other speaker had said about the lack of publicity and promotion of the program services. That was one thing. That was a concern. And people, when they did reach out, what happened was there was like lack of motivation to impetus to go and follow through. And people had different degrees of self-isolation. Some are willing to go out. Some are really, really leery and wanted and was being very conservative about going out to the services. There were some suggestions about solutions, about Facebook, about Twitter, using Facebook and Twitter. And another member of the group said that people are using those channels to stay connected, so they're kind of overloaded. So the messages gets lost. See, and uh, another member also shared about children at home not being able to find time to do these like the programs because there's no daycare, there's no way of helping, fear that they can't bring the children out because they're afraid of the children's health if they do. So one person, I believe is Sheehan, I don't know her, Sheehan Lopez, she has suggested going the low tech way, doing flyers, printing out flyers and putting them in grocery bags that are being delivered to the needy. That might help. And like at People's Place or the Kingston Collaborative, Food Collective, Ruth Stratton had asked if any of the members in the group could have know of mental health counseling to support families during the COVID crisis to minimize abuse of spouses and children. So if you could email chat to Ruth Stratton, that would be very helpful with sources that people may have.
Any other ways that your group is working to solve doing recruitment or outreach?
No, I think that was it.
Okay. Thank you for sharing, Willie. Do we have another reporter? So we had group 1 and group 3.
I'll go.
Great, thanks, Janie.
From group 5, I think. One person said that she was just keeping track of the daily news about how many people can meet and trying to make plans around that. They're talking about maybe meeting outdoors under pavilions, to continue trainings and meeting with people. Let's see. She also talked about walking groups where I guess there's a community called SIP, Staying in Place, and maybe becoming part of other online groups that are Zooming outside our normal groups might be a way to get the word out about our different programs. I don't know how you find out about the other groups, but let's see. Also, she mentioned something that I thought was interesting. She said in one of her groups there were 5 people that showed up and she thought that was great. So maybe changing our definition of success would be something. And I guess reaching out to local, like she mentioned, the Lions Club, things like that, that have Zoom meetings for their meetings. But other than that, I think that was it. Okay. And everybody talked about the same problems and frustrations that have already been mentioned.
Okay. Okay, so these are solving. Thank you, Janie. And we should have 2 more group leaders. Can we have one more step forward? Virtually? Dakota? Can you speak up just a little bit, Dakota?
Sorry, I'll get closer.
That's good, thanks.
So I think group 4 was myself, Thomasine, Doreen, Melanie, and Christine. So we talked about many of the same concerns that everybody else did, not having email, not having social media for our clients, or our clients not having them, trying to work towards grant with other agencies. I think Thomasine was talking about the ability to try and find either internet or electronics for clients through those processes. We also talked about through Office of Aging, everything going virtual, how it might be difficult for seniors to have these devices, or for them to be able to virtually access them and learn how to use them. Clients in general feeling comfortable enough to go virtual, because that might be a change for some. The problems of our own use of technology at home and how things glitch and crash, I mean, that happens as well. And being able to provide services in person safely. So we set 3 major concerns. Were concern for privacy for clients, technological issues or no access, and isolation. And we talked about ways of working towards recruitment. The 3 major ones being improving virtually, because a lot of us were so paper driven and having to get things to go online, and safety for social distancing in person. Like I said, some of us were talking about tents or pavilions, or how we were working to remain 6 feet apart, but still providing services for clients one-on-one, and more contact by phone, email, text, apps, whatever agencies are deciding to use. I don't know if I missed anything.
Okay, thank you. We have one other reporter.
Yep, that's me. So some of our top concerns were our members not being tech savvy or having various technology troubles. There was also concerns some of our audience had about confidentiality, you know, not being confident about sharing their space or their video, things like that. And then a big concern we had was just kind of a lack of motivation or ability to participate with, you know, when you're busy trying to keep your business going, or, you know, just dealing with trying to survive. It can be tough to think about these other things. And so some of our solutions that we thought of, or what's been working, is Carrie had let her audience opt into text messaging, which she found worked really well to stay in touch. And then to expand on that, you know, Emily had been using Instagram, which worked really well, and just generally using different communication formats. I've been using Teams to talk to my students to help address confidentiality concerns. Jody has had let her members, they can mute themselves or turn off their video, or they don't have to put their legal name. You can change your Zoom background, different things. You don't have to necessarily open a video into your own home. And for dealing with motivation and you know, too many other competing factors, something that worked for me fairly well with my students was sending out actual physical activity packets with activities we could work on together. So we'd meet via Zoom, but we'd have physical things that we were all together with. And then Emily has been having some meetings outdoors, which has also worked really well for her, she said.
That's great.
Thanks.
Thank you. Is there anyone else who had anything else to share? I think we hit all 5 groups. Are we good? Because I'm going to summarize everything in just a moment. Just going to put back where we are in the meeting. I want to thank everyone for your hard work in your breakout rooms. Everybody seemed to really, totally go to town. I popped into a couple of them and everybody was busy at work. And I think that, it was really great to see everyone doing that and having really meaningful discussions. One of the things that I wanted to do and have come out of this meeting, we will have meeting minutes that will also be posted. Make sure I go in the right way here. But I wanted to definitely, after you've all reported back, just kind of have that little discussion of what it is that's alike. I think everybody who is trying to run programs or work with people during this time, we're all having a lot of the same issues, which I heard arise. One being clearly technology. Some people are good at it and some people are not. And a lot of people don't have the equipment that they need or the internet service that they need to make communication meaningful. And I understand that perfectly. I'm not in my own home right now. I have satellite internet, and for a meeting like this, it's just not good enough. So I have been doing most of my meetings in my parents' home, which is a little bit away. So that's been my workspace while our office has been working from home. And some people don't have that option. So, technology is definitely an issue in having access to it. One of the other things that I heard come out very clearly as an issue, of course, is that follow through. People are interested in your programs, they're connecting with you, but they are very distracted with so many things that are happening right now. Trying to work from home, kids at home as well, trying to handle childcare, and then you have to figure out how to get back into the workplace and what do you do with childcare, and it's really hard to think about taking that nutrition class or reaching out for the help that we need at this time, because we're trying to problem solve so many other things. So it's difficult to have follow through, even though we know we want services. So that's an issue too that everybody's been dealing with as well. And then just as I'm sitting here listening to is how do we promote these programs that we have when we're getting a response but we're not getting the follow through, and we can offer some things outdoors, but people have varying degrees of whether or not they want to be back in a group. So that doesn't always work either, even if we know we're going to offer something outdoors and offer social distancing and wear our masks and follow CDC guidelines, it's still presenting some difficulties. So, and then of course, working with seniors has its own issues of, again, a lot of times there are, difficulties in technology or availability of technology, and trying to solve those problems of isolation for so many people. And I think somebody hit the nail on the head when they said, we are connecting, but we're connecting so much digitally, we're exhausted digitally. So we don't want to do something else by, online virtually. It was enough to connect with our family and try to make other things happen. We just don't want to sit in front of that screen anymore. And especially if you've got kids at home and they're also doing schooling online or they've got other programs online. So some of the solutions that I heard come out were a little bit of a mix of what you're going to do. And that was to include brochures and some of your outreach materials physically in places where they will be accessible to people, whether you're working with folks that are going to be picking up some food at people's place. You can put it in see if you can add your outreach materials there, or if you know there's a bulletin board in the community or a library that you know is open and people are going to. Trying to get your materials out there physically, not just digitally. And then, of course, some people have chosen to kind of do that little bit of a mix, which I think I've heard a lot of success with, is sort of putting together, I've seen it in so many varieties going around online, you know, the camp box or the activity box, or a package for people where they get something and you actually drop it off and then you meet later online and discuss it. So they have something tangible in their hands that makes them want to come to your meeting or come to your program virtually. And then, of course, meeting outside in small groups, following guidelines where people are comfortable. Some people find that important to have that face-to-face kind of contextual conversation, which some of our programs lend themselves to and some of them do not. And then, of course, that problem of privacy. I did hear that, you know, yeah, learning those tools of changing your actual name in a Zoom call so it doesn't say your whole name, or not using your video, not using your audio. There's so many things that I'm so grateful to hear that you're all trying to do. I hope that listening to everyone's conversations was valuable, and you know that we continue this conversation with each other and how we're going to promote so many of our programs. That, you know, just from having worked with the Healthy Ulster Council for so many years, I know so many of your programs, and they're so valuable in the community. So you know, just kind of bouncing it off each other, because we get sort of stuck. How do we reach people? How do we get out to folks, and how do we get people to our programs? So I hope this was valuable and just kind of bouncing those ideas off of each other. And remember that we're here to continue the conversation by email, or, you know, reaching out to one another. And you can certainly reach out to me or to Stacy. And that's one of the things I wanted to kind of put up here. We're coming towards the close of our meeting. We have about 3 minutes left, and I do want to honor the time that you set aside for this. First, I just wanted to share that our next Healthy Ulster Council meeting is in September, as always. It'll still be held Thursday, September 10th, 2020, from 2 o'clock to 3:30. It will be an online Zoom meeting. We're shortened that by a half hour because 2 hours does seem like a long time to sit in front of your computer. When we're together, it's a 2-hour meeting, but we get up, we move around, we have a snack. There's a little more to it. So, you know, we will be meeting again in September, and we want you to be able to find the information from this meeting. The PowerPoints and recording the meeting and meeting minutes, meeting notes will be available to you at our healthyulstercounty.org website under the community tab. And also, you know, I just wanted to be sure that you also know that you can reach out to me. My email is there, or to Stacy Kraft. If you have more questions or you want to carry this conversation a little further, we can connect you to some of the people in the meeting. If, you know, someone in your small group or someone you heard talk today had good ideas that you want to explore. And of course, Thomasine, her PowerPoint and everything will be available to you as well. So you can go and look at that information again if you want to get more information. She shared so much in her presentation today on employment training in today's situation of COVID. And Stacy and Vin, do you have anything you want to add before we end the meeting?
Yeah, Melinda, I was just on a previous webinar that was put on by Massachusetts Hospital for, it's a healthcare support network that they created to help healthcare providers. And there was an amazing message, and I'm wondering if I could just share it with the group on the share screen. It's just so, it really picked up my day, and I think it would really do the same for others. Do you mind if I do that?
Yeah, let me stop sharing and you should be able to do that. Absolutely.
Okay. I don't know, can you see that?
Yes. Do you want me to read it?
People can read it, or if you want to, sure, yeah.
I'll let people read it. I think that's a good idea.
I just thought it was really awesome. Good way to end.
I don't think we could say it any better, Ben. I'm glad you shared that.
Thank you.
And I just want to also say I'm going to put in the chat a link to the Robert Wood Johnson Foundation data so that we can pay attention to that and know that we are looking at how we're performing compared to other counties and other states. And that data comes out every March, and we're working to align our programs and services in the county in the evidence-based realms of health and wellness promotion so that we can make the biggest difference. So that is part of why we do this survey, and we hope that you all will take it seriously and get your data back to us on that when the information comes.
Yes, thank you, Stacy. That's really important. Vin, everyone is asking for a copy of this. Is that something you can share?
Yeah, I'll send that out to you, and you can
I'll
send it
to
around.
everyone. Well, thank you so much, everyone, for attending our July 2020 Healthy Ulster Council meeting. We hope to see you in September. We will have a presentation by Hospice, and I think Sophia is here at our meeting. So, that's also a really relevant topic. And I know she shared some of her resources in the chat box during this meeting as people were reaching out with questions. So we look forward to that. And stay safe, be well, and continue the good work that you all do. Thank you so much.